Cambodian authorities have informed us of 2 confirmed cases of avian influenza H5N1, both members of the same family. One of the cases, an 11-year-old girl, unfortunately passed away. We are in close communication with the Cambodian authorities to understand more about the outbreak. Field investigations are ongoing. The global H5N1 situation is worrying, given the widespread of the virus in birds around the world and the increasing reports of cases in mammals, including humans. H5N1 influenza is a severe respiratory disease with a range of symptoms observed from mild to fatal. The mortality rate among cases reported with H5N1 infection over the years is over 50%. WHO takes the risk from this virus seriously and urges heightened vigilance from all countries.
Is there any data yet on the genetic sequence of the virus from the girl in Cambodia? And the second question relates to the updating of the strain for H5N1 vaccine. Has any work been done to look at whether existing stocks of H5N1 vaccine would work against contemporary viruses? Thank you.
Yeah, I'll first start with Dr. Briand on the details, although I think we have too little information yet, but please go ahead and then we go to Dr. Verby.
I think the first question was on the genetic sequence, so maybe Richard can address it.
Then perfect, Richard.
Yeah, hey Helen. So no, the information is not yet available on the specifics of the human case, but just to sort of add on top of what Francisco said, you know, in Cambodia over recent years, they have reported in their poultry through the H5 reference lab and others in country, there are multiple clades of H5 circulating. That includes the 2344B, which is the one that's spread through Europe, into Africa and the Americas now, but they also have a 2321C, which is a lineage that's been a little bit more localized in that region of the world. So, yeah, right now we can't make the determination or even what the likely outcome of that is. Yeah, in terms of your other questions, it's a great one. So, you know, there are some stockpile vaccines, some trials that have been done, and there has been a little bit of work looking at some of those. So serum collected from people who took part in vaccine trials to some of these earlier H5 clades, and they actually, the serum for those people actually reacts quite well with some of these recently circulating viruses, which, you know, again, from a stockpile vaccine or response point of view, I think is encouraging. That, you know, suggests that the human response to some of these vaccines, if it's an adjuvanted vaccine at least, does induce a broad immunity that cross-reacts with a lot of these clades that we're seeing. So from that perspective, yeah, I think it's encouraging.
Hello, this is Claire Wilson from New Scientist magazine. Could you tell us what would be the next steps if we got the really bad news that the bird flu viruses had started being easily transmitted between humans? You know, what would happen next? Thank you.
Yeah, big speculations. Let's start with Dr. Briand and then have others chip in here.
So, and this is why we are monitoring the situation very carefully, because there are some very short-term activities and interventions that we can put in place. First, to reduce the human-to-human transmission by treating cases, isolating cases so that they don't further transmit the virus, but also identifying contacts, and we can use antivirals for and to treat those contacts for post-exposure prophylaxis and reduce the likelihood of further human transmission as well. We will also, of course, try to control the source of the virus in the animal population, so that we have also less risk of spillover from animals to humans. And so these activities, of course, will be focused in the areas where we see the novel virus starting to have this capacity to transmit from human to human. And there will be enhanced surveillance in this area so that we can make sure that this stays contained in this geographical area. And so while we are doing these very early containment activities, we will also obviously look at the potential extension of the transmission and get the neighboring provinces or countries ready for a potential human-to-human transmission as well. And basically, we have 5 types of intervention. Of course, we will look at the surveillance, and really have our surveillance protocol in place to be able to detect any signals, but also to monitor the circulation of the virus and the disease and its impact on population. We will also, secondly, have protect the communities, inform people, and make sure that they know what are the risks and what they can do about it. We will also, of course, strengthen the care system to make sure that they can attend the patient and also protect healthcare workers. And we will also start the development of countermeasure, be it antivirals or vaccines. And finally, we will ensure that there is a very good collaboration and coordination between sectors, between stakeholders also, and at national, regional, and global level. So we are not yet there, of course, but we are. That's why we are starting to exchange information so that everybody is aware of the risk, and we can very quickly react and put in place those interventions.